Hello everyone, and a warm welcome from Henry Schein in London this evening. Today we're very lucky to have with us a real veteran of Tubules Live. This, I believe, is your third one, Rana. This is Rana Al-Falaki, and she'll be talking about lasers and their role in cosmetic dentistry.
That's it.
Previously, I think you've obviously talked about the overview, indications, how GDPs can get involved, different courses. Now the focus has switched a bit more towards cosmetic.
Yeah, I thought we'd follow on from Tubules Live last week, which was talking about cosmetic dentistry, and I thought we'd show you what we do with lasers in the field of cosmetic periodontics, which a lot of dentists aren't actually aware of what we're able to do to enhance the restorative side of things. So we'll hopefully be covering lots of interesting cases.
No, great, absolutely, because I myself, every time you've given Tubules Live, I've learned so much about lasers and indications, so I'm looking forward to how that can fit in with the cosmetic side. So let's have a great show tonight.
Fantastic.
Thank you.
Okay, so as Jazz mentioned, we're going to be talking about the use of lasers in cosmetic periodontics. So other than just treating gum disease, as periodontists, probably, well, for me, maybe 30 or 40% of my practice is also spent doing surgical treatments to enhance the shape or morphology of the tissues to help with cosmetic dentistry. And of course, that is such a huge field nowadays. So a little definition for you. Part of what we call perioplastic surgery will be these cosmetic procedures. So really we're going to be talking about the manipulation of the hard and soft tissues to achieve these improved aesthetic outcomes. So hopefully I'll demonstrate to you that really very subtle changes can make quite a big difference. It's going to be talking about lots and lots of cases today. I'm going to try to cover crown lengthening and then slightly more subtle, just soft tissue gingival recontouring. We'll look at restoring biological width, which can end up looking quite unsightly, but it's also obviously we want to get rid of inflammation, so that's my periodontist hat on again. And then we'll look at depigmentation, some root coverage procedures, so treatment of gingival recession. And look at how we can manipulate things, remove lumps, thin out tissues, and some final case to finish off with on lip repositioning, so back to how to manage gummy smile. So lots to get through, but as you can probably gather in cosmetic perio, an awful lot of it is going to be cases to do with crown lengthening. So what are we talking about with crown lengthening? We could just be talking about just reshaping the soft tissues, which if we're talking about lasers, that's something you can do with a soft tissue laser, so something like a diode laser. But all the cases I'm going to show you today are the water laser, the erbium chromium YSGG laser, which is a hard and soft tissue laser. So we can just do gingivectomies, reshape the soft tissues. Alternatively, we could work on the hard and the soft tissues. And why we might work on the hard tissues could, of course, be for a restorative crown lengthening case, which I'm not going to talk about much today. But also, even with cosmetic cases, we have to make sure that we maintain that biological width. So if we put those margins of those crowns too close to the bone subgingivally, you're going to end up with big red, purple gums and lots of inflammation. It's going to look unsightly, it's going to bleed, or the gums are going to recede, and the patient isn't going to be very happy when the margins of their crowns show within a couple of months. So we must preserve that biological width. So that's where hard and soft tissue crown lengthening are going to come in. So when we do traditional crown lengthening, what I would have done pre-lasers is I would always look at cutting, of course, with the scalpel blade, getting my tissues to the right shape. Then I'm going to raise my flap, periosteal elevators and so on, remove my bone with a handpiece, so burr to bone, put my flap back, suture it up. I very rarely give antibiotics even with that, but then there is a risk of sort of post-operative pain, swelling, perhaps a little bit more recession. And according to most of the research papers, it does actually take 3 to 6 months for the gingival margins to ultimately settle down. So the longer you can wait before you restore these cosmetic cases, the better. So often we then have this temporization phase for several months before patients can go on and have their crowns placed. So that was the traditional method, and of course I'm going to show you lasers, and hopefully you'll see how it can really potentially make a big difference. And I think one of the biggest things to mention with lasers, which again I'll summarize at the end, is that with all these cases we tend to get much less pain, swelling, post-operative side effects due to what the lasers are doing in there. So I'll explain more of that as we go, but let's start off with this first case. So this lady was referred to me by her dentist. Now I just want to show you, you can see the top view over here, but if you look at this, this side, you'll see the canine is particularly long. So he'd suggested to me, Rana, could you see this patient and try and do a bit of grafting on this canine over here, and then we'll look at some gingival recontouring. My feelings with her is just that there wasn't actually much recession on that, but obviously you can see there's sort of quite a clift. It's quite kind of triangular in shape there. And she wanted big teeth. She actually felt that her teeth were a little bit too short as it was, and there was still enough keratinized tissue around that canine. So I suggested to her that actually, why don't we use that canine as a reference point, level it off, even out all the gingival margins throughout. After we'd done the top, the dentist then suggested we did the lowers as well, and ultimately she wanted to have everything recrowned and reveneered for a more cosmetic smile. So that's exactly what we've done. So remember, we're using a hard and soft tissue laser. So this is it immediately after treatment. So what I've done is, ideally, in the ideal world, if you're doing this yourself, I would always say work backwards. Get your technician to do your diagnostic wax up so you know where your end point is, get a stent made and use the stent to cut the tissues. In my case, in a referral practice, unfortunately, a lot of my dentists won't end up making the stent for me, so a lot of it ends up being freehand. But that's fine, we get around it in the end. But of course, remember with lasers, you get very little bleeding. So we will draw on the gingival margins, we'll sit the patient up, we'll take photographs, we'll keep changing their angle until we're all completely happy with the final shape before we end up cutting. And laser cutting is something that we call ablation. So what you see in the top picture there is we have reshaped the gingival margins, we've done gingivectomies, and then I've gone flaplessly underneath those gingival margins and removed the bone, because of course I have to preserve the biological width. So those crown margins are going to be where the new gingival margins are, and of course from that point we need to have 3 to 4 millimeters distance to bone. So contraindications for doing something like this might be if those crowns were particularly bulky, in which case I couldn't get subgingivally without really pointing the tip in towards the bone or the root surface, and of course I don't want to do any damage. Likewise, if those tissues were really thin, I wouldn't do it flaplessly either, because I'd just end up ablating away the soft tissues. But in your case, this case, you can see the tissues aren't particularly thin, and so we've gone in flaplessly and we've removed the bone. And when we do that, we always feel with instruments afterwards to make sure that we haven't produced any craters or pits, or the bone is really nice and smooth at the end. So you can see the top diagram, that's the front view. Going to the middle of the slide, you can see the right and the left, how we've reshaped it. And this is after bone removal, which is why you can see a little bit more bleeding, because we will get some bleeding of the bone even though we're using lasers. And of course that's exactly what I want. I don't want to fry the bone and risk necrosis. So that's also really, really important. We use lots of water here to make sure that we don't damage bone. And that's why we wouldn't use a diode laser. We just get too hot and cause bone necrosis. This bleeding tends to stop very quickly, and otherwise, if it, all we do if there's a bit of propensity for bleeding is just compression with gauze and send the patient home, usually with some kind of post-op instructions just to say, don't go crazy at the gym. And to be honest, most of my patients love me when I say that to them anyway, so that I always seem to get a smile. And then you can see in the lower slide how we've reshaped the lowers as well. So the same thing, gingivectomy and flapless bone removal. So this is her healing a week later. So you can see the tissues heal up really, really nicely, which again is one of the advantages we find with using lasers, that we do get this accelerated healing. And usually the patients have very little post-operative pain or swelling either. So this is how it looks just after doing a tiny bit of tweaking. So my feeling was the upper left central incisor didn't look quite right. You can see on her smile ultimately when that's crowned. But it is difficult to tell with things like this, because when their teeth are already crowned and you only see little bits of root surface, it can be quite difficult to see what the final appearance is going to be like. So sometimes patients will go for temporization at this point, and certainly if she was going to go around like that for several months, it would be a good idea to put temporary crowns on at that point. Other indications for them, of course, especially in cosmetic cases, you have to meet those patients' expectations. So if you do place provisional crowns, it's a really good diagnostic approach to allow your patient to tell you what they like and what they don't like. Are they happy with the shape? Are they happy with the size? Are they happy with the colour? So temporization wouldn't be a problem at all. But in this case, she was going to go and have her crowns done within a couple of weeks of doing the crown lengthening, so she just decided she wouldn't smile very much for this period of time. And this is, again, one of the nice things with lasers, is that the gingival margin tends to stay much more stable than when we cut it with a blade. During the healing, we phase out or eliminate a lot of the inflammation, which is part of the healing phase, which is why those tissues tend to stay a lot more stable, so they can go ahead and have their restorations. So we did a little bit of tweaking. You can see in that middle slide, I've just reshaped it a little bit, particularly the upper left lateral, and that's the lowers after a week. So again, you can see how that's really healed up beautifully, and I'm sure you can definitely imagine how it wouldn't be a problem to go ahead and get those crowns made pretty quickly. So this is her final shot. She didn't actually come back to me for over a year, but she came in with her daughter for something else. So I managed to catch her and say, you were supposed to come back so I could get the final photo, because I don't often get the final photo, of course. They go off to their dentist and I don't see them again. But she came in, so this was her final photograph. So I think it's actually very good to use that, because also you can see we've done it flaplessly and there's no redness on the tissues, there's no inflammation. So I know that those gums have really been behaving for over a year now. So no impingement of the biological width. Patient was delighted. Her choice of colour and so on, nothing to do with me, but patient was very happy. The guys here were laughing at me because I was saying, yes, this is probably your typical Essex smile, which is where my practice is based. You can't see the whole face, so we can't see the fake tan, but here we go. This is a comparison to what she looked like and what she looks like now. So yeah, understandably makes a big difference to somebody's confidence, which is a wonderful thing about dentistry. Of course, we all know that's we really can make quite a difference. Okay, so here's another case. This guy needed orthodontic treatment. So you can see he had a lot of crowding, and I'll show you how he looks once his orthodontics is finished off. But you can see on the lower insides of teeth particularly, the tissues are really thick and the gingival margins are really high up there. And so you can see, even when he's speaking, all these gums are showing at the bottom, which isn't exactly very sightly for actually someone who is a good-looking young guy. So if we just look at the intraoral view once his orthodontics is finished off, you can see his teeth have been beautifully straightened. An issue with his lower canines there, a little bit buckle in the arch. Tissue is very thin. We need to be careful about recession there. But again, you can see how thick those tissues are around the lower incisors. And also note the papillae as well, how flabby and wide they are. That's something that will be prone to periodontitis or pocketing down the line when the tissues are that thick. But of course, you could saw what his smile was like. That would have shown a lot. So this is the post-op. So other than the fact that we've removed the gum and we've removed the bone, because again, we've re-established biological width, he isn't having any restorations placed, but if I don't preserve that biological width, then ultimately the tissues will regrow. So we want that to stay stable. But another thing we're able to do with the precision that we use with these lasers is you can see how I've really reshaped those papillae, so how I've recontoured them and flattened them off and thinned them out, which again is just something I couldn't do successfully with a scalpel blade, and certainly not do it and leave my patient in no pain or soreness straight afterwards. So he was delighted with the result. You can remind you how he looks before, and that's how he looks afterwards. So, happy, smiling, but, you can still see the papilla. It's a lovely smile, but none of that thick fibrous tissue. So that's just another example of a more sort of subtle cosmetic case that you don't always need to end up having crowns put on. This is another case. I'll often end up having teenagers and children referred to me now because our dentists have realised that actually lasers are a little bit more patient-friendly than packing them off to the oral surgeons, and certainly not as scary. So this girl, she was in her early teens, petrified of needles, petrified of dentistry, full stop. But she had this peg-shaped lateral incisor tooth that needed some contouring, it needed reshaping. You can see how low the gingival margin is, so she needed that increased. She ultimately wants to have a lovely smile, and this tooth was then going to also be built up with composite and perhaps ultimately a veneer. So this is how it looks immediately afterwards. We've just used a bit of topical anaesthetic in this case, and managed to get away with doing a gingivectomy and reshaping, and then she went on to have the tooth restored the very next day, because as you can see, very, very little bleeding there. So I'm starting to build a picture for you for the advantages with how we use lasers. Again, this is another young teenager. He just finished his orthodontics. So often the case when they have these thick tissues and they have orthodontic treatment, then what happens is their teeth get really bunched together and they end up with papillae that often look like this. So this wasn't just a poor oral hygiene issue while he had orthodontic treatment, but it's to do with the bunching. So again, to start using a scalpel blade on this and try to reshape this and define it would be quite a challenge. Again, young patient, nervous, doesn't like needles. So we've been able to really use a lot of very fine precision with the laser just to reshape those papillae. So it's subtle gingivectomies. So this is how he left the surgery to then, I get them to brush this straight away, but you can see a lot more of his teeth showing, and after he's had all his lovely teeth straightened, we want him to have a confident smile. He did have quite a gummy smile as well, you can see that. So a delighted patient. Oh, wrong hand. If I just show you how just about this level, you can see how we've really tried to thin out those papillae for him. So it's subtle things that you might not think of when it comes to cosmetic perio, but it's actually quite easy to do and can really make a difference. So here's a video, step-by-step procedure for what this flapless crown lengthening looks like. So we're using, you can see here, like I was talking about, he's got thick tissue, so flapless crown lengthening is indicated. I wouldn't be using this technique either unless I was just going line angle to line angle. So I'm not going to do flapless crown lengthening if I'm trying to remove interproximal bone. But you can see, this isn't my video, it's one of our UK laser trainers, Mark Cronshaw here. He's using a long zirconium tip. It is letting off lots of water, and the laser just tends to make a clicky noise, a popping noise, which the patient obviously hears, and we have the suction going as well. There is a smell, although you can see we're not really burning the tissues. It's just something called the laser plume. That's what happens really when the tissues are evaporating, which is how it cuts. It's a term we call ablation. So you can see here he's doing a gingivectomy, and he's using it quite parallel to the tooth. So we're not pointing the laser tip into the tooth. We're not damaging the root. We're not doing anything to that tooth surface. But you can understand why I was saying if you had the tip in there and the teeth were particularly over-contoured, you wouldn't be able to get in at this parallel angle, in which case you'd be going into the root surface. So this is where, getting to know your indications and contraindications are important. So now he's going in just below the gingival margin, and you can see he's just going side to side, and he's just going to start doing this flapless bone removal. And like I said, we do have some tactile feel, so you will be able to feel with the tip when the bone is smooth. So you make sure you're not creating ledges, you're not creating craters, which of course you could do if you were inexperienced or just went in it gung-ho. So like with anything, there is of course a learning curve, but you can see very little bleeding, and nice and simple for the patient. They walk out of there, and like I said, if they really want to go back to the gym, within 2 days I let them. In terms of other post-op, eating and drinking completely as normal, and actually I try to get them brushing as quickly as possible to avoid the risk of rebound. So sometimes it can feel a little bit sore on the edges, in which case we're giving them mouthwash to use. I'll usually use Ultradex. That's my choice of preference, and then they'll use that for the period of a week, but try to brush as quickly as they can to try to preserve those margins. So yeah, usually within 2 days they're brushing pretty normally. So you can see there on this video we're just going in and doing the bone removal. And if you see how the tip is moving, that's because you can feel the bone giving way. So it's almost like a brush stroke type movement as you feel that bone. I will often go in afterwards with a probe, and I will just keep running my way along that bone margin to make sure that it's smooth. No need for sutures, of course. And in terms of timing, I have to say I still book off the same amount of time as if I was raising a flap. So it's true I don't have to put sutures in, but to be honest, it probably takes me an equivalent time. So I'm doing it for the other advantages that we've talked about. So there we go, he's just going in and finishing off that bone removal. So as simple as that. So last case to show you before the break. This patient came in, you can see he's got a very different smile on both sides. Very strange appearance actually. So the teeth on his left side are all nice and long, and he wants the right side to match up. And of course he can see these black margins from his current crowns. You can also see, if you look at the lower photograph, how the teeth are a bit shorter and he has a bridge there, and how the upper right premolar tooth is really very short as well. So we want to lengthen that all up, try to get it to match the left-hand side, and really also increase the size of that pontic area so that that tooth looks longer as well. So this is it after the bone and tissue removal. So again, I'm working freehand in this case, but you can see how we've tried to match up the gingival margins. And on the lower photograph, you can see how I've kind of gouged out the pontic area. But of course, we've done it with lasers, which makes it much easier to do. It would be very difficult to do that with a scalpel blade, and you would have to pack it. And of course, it'd probably be very sore and painful. So we've taken that out so ultimately they can have a nice long pontic, and we've done the bone removal. This again is how it looks a week later, so you get an idea of the lovely healing, and the more he brushes that, the less inflammation there'll be. So particularly on that lower picture, the canine still looks ever so slightly inflamed, but again he just keeps brushing that and ultimately gets that restored. He did have his restorations, but pointed out to his dentist that he wasn't happy with these black triangles. His dentist thought I had removed the black triangles, which you can see from the previous slide. I haven't at all. But it's just sometimes these are the restorative challenges that we end up with, in that perhaps he can't have ideally shaped teeth to match the other side, just because, you know, of course, this all gets made up on a model, and ultimately you can see, you know, I cannot regrow papillae. I'm not a miracle worker, unfortunately. So he needed to have a little bit, basically increase the contact points to eliminate the papillae, but you know, still a nice result. Patient certainly happy enough with that. If we look at how we've increased the length of that pontic as well, really nice fit. And hopefully if we've kept that bone distance nice and healthy, you can see how the tissues look lovely and healthy even with slightly subgingival margins. So that's him once he's been restored at the top compared to how he was to start with, which is great. And of course, in the world of cosmetic dentistry, how I always say when I present this case is then no doubt if you're a cosmetic dentist, you'll get your Botox out and just bring his right lip down a little bit, and then we have a lovely even smile. So I think that's enough on crown lengthening. I think we're going to go to a break, and then we'll talk about a few other cosmetic things we can do with lasers.
Rana, thank you so much for that first part. What I really liked about was the speed at which everything heals, and I think your cases really exemplify the importance of the pink aesthetics in a cosmetic dentistry. So thank you for part one. Make yourself a cup of tea or a coffee, and we'll be back in about 5 minutes for part two.